Good morning. I'm pleased to introduce Mrs. Ife N. Cromwell Milton. She will be our next speaker. Mrs. Milton is a licensed medical social worker at Medical University of South Carolina. She works with sickle cell patients who are admitted and those in the ambulatory clinic, the adult clinic, and pediatric clinic, and she works with their families to provide a continuum of care. She's originally from Brooklyn, New York. However, she grew up in Charleston, James Island, and is a United States Army veteran. Thank you for your service. And she earned her master's degree in social work from the University of Southern California. Ipe believes in meeting people where they are so that they can achieve the best outcome for the results they want to achieve in their lives. Let's welcome Mrs. Cromwell Milton.
Thank you, Dr. Jackson, and thank you, Reverend Cook. This is my first time presenting with COBRA, so I would like to say thank you for inviting me. I am new to working with sickle cell patients, so I would like to say thank you all for having me to work with you guys. And I've been learning a lot as I've been working with everyone, and I've been learning a lot from the families as well as the patients. And so I'm going to discuss transitioning with sickle cell disease. There's a paradigm shift. Transitioning occurs during all stages of life. With young adult patients with sickle cell disease and their caregivers, it is important that everyone is aware of the shifts that take place, not only physically, but also medically. In the 1970s, sickle cell disease was considered a pediatric issue only. According to researchers, more than 90% of individuals with sickle cell disease live to be at least 21, which changes sickle cell disease from a pediatric only concern. Thanks to early management, 95% of sickle cell disease patients reach adulthood and require transition from pediatric to adult care. When thinking about the transition from pediatric to adult care, topics to be addressed are the young adult taking charge of their own health care, the guardian no longer having all rights to the young adult patient's medical and financial affairs, which I have been finding that the adults or the caregivers have been having problems with that transition because as a parent, you've been taking care of this child all their life. You may have stopped working, you may have stopped going to school, you may have had to put your other children on the back burner somewhat so that you can take care of this child. And now that they're 18, the healthcare world is saying they're an adult. We're going to talk to them and not you anymore. And that's difficult for a parent. I'm a parent and I still am a little overbearing. So when you go into the room, you have to make sure that you're letting these patients and their parents know this is what's going on. However, there are documents that they can sign, and we'll talk a little bit about that later. Adjustment to a new care provider as an adult is one of the transition concerns. Education and career goals, options while having sickle cell disease, and caring for themselves and psychosocial needs are all transitional concerns. For successful transitions, a healthy collaboration between the young adult, healthcare providers, and guardians must occur. Positive disease management and independence is essential for healthy outcomes. This is achieved by ensuring the young adult understands sickle cell disease, medications, how and when to achieve healthcare assistance, understanding insurance and disability benefits. At this time, it's time for the parents or the guardian to pass the baton. It's time for them to let go of some of the responsibilities they've had all 18 years, or in MUSC's case, 24 years, and pass it on over to the child or the young adult, the youth. It is imperative for the guardian, patient, and healthcare providers to have a discussion with realistic expectations of who will be decision-making moving forward with the transition. The caregiver should be made aware that conversations, billing, and documentation will be the responsibility of the transitioned patient. And this is where the difficulty comes in. Providers and caregivers will need to discuss the maturity and cognitive levels of patients so that documentation and transition into the adult world will not be problematic. Patients' insurance and disability documentation process, if applicable, will also need to be addressed and completed prior to the transition. Documentation giving permission for healthcare team members to discuss the healthcare of the patient is essential in building the young adult trust and avoid HIPAA violations. No one wants to have HIPAA violations when discussing the patient's medical information with their parent. Some children, when they turn 18, they are like, this is my business. I don't need my parent in my business. Where there are some children, or young adults, I should say, that are like, oh no, talk to her, talk to my mom. They're not ready to release. And parents don't understand that it's no longer your responsibility to take on this role because they're 18. So it's a balance. And as a social worker, I have to go in and speak with them, or as our patient care coordinator, we have to go in and speak with them and say, hey, we have a form. And most places have a form that they can sign, and they can release that, ability for us to speak with their parent or whoever the legal guardian is. In some cases, the documentation for the child is essential to understand if there is a cognitive delay, because then we have to go another route. You can't always say, oh, because the child is 18, we're going to let them make all the decisions. Well, if there's a deficit and the child is not able to sign everything themselves, we have to take that into consideration also. Understanding the body. So not all patients understand their body completely, because the parent has been taking on all of this responsibility and letting the child just move on their lives as a happy child as best as possible. And they were not learning anything about the sickle cell disease, but the parent was taking on the role of learning everything. Patients need adequate knowledge of the sickle cell disease, i.e. reproduction and genetic inheritance. So what's important is that the youth should begin with the guardian and or healthcare team to discuss reproduction, because whomever they choose to procreate with may have the trait or the disease. So they have to understand when procreating, because we all know these children are going to grow up. They may want to have a family. They have to understand when you go to procreate what the chances are of you having a child with sickle cell disease. Also, for male patients, they have to understand the effects of sickle cell disease on testosterone levels and sperm. Menses onset is delayed in females with sickle cell disease, and menstrual bleeding patterns are normal. However, sickle cell disease is in association with an increased sickle cell disease-related pain. So at 13, or a little before 13, we start discussing with young females that sometimes their crisis may come on because of menstrual cycles. That's important for them to understand and know what some of their triggers are. It is also necessary for the youth to have adequate knowledge of baseline hemoglobin levels, as well as understand when to seek medical attention. And not be shy to seek medical attention. Some children keep pushing because they think they can handle everything. By the time the youth are ready to transition, they should recognize pain triggers. The youth need to have the ability to name their pediatric and adult hematologists, also know how to contact them. Some of the factors that cause sickle cell disease are infections, low oxygen tension, dehydration, physical, psychological stress, alcohol, pregnancy, and cold weather, just to name a few. It is also imperative in transition for youth to be responsible for knowing their pain regimen and the medication that they take by name, dose, and the effect reactions that the medication has on their body. Patients' ability to self-manage is important in the transitioning process for best healthcare outcomes. Some of the medications that they may take could be opioids, corticosteroids, acetaminophen, and NSAIDs. Patients must be able to recognize which medications may cause drowsiness if they come into acute clinic, if they can drive home, which in most cases they cannot. They have to be able to identify someone who can drive for them prior to even coming to clinic, And if they can't have anyone drive for them, maybe they can use Medicaid as a transportation. And if they are planning on doing that, they have to know how to use those services. So they have to be taught how to use those services, not only for the parent, but also for the child, because maybe they want to use those services to come to their regular appointments. According to an article written by Health Day, News for Healthier Living, sickle cell disease attributes costs were estimated at 1.6 to 1.7 million for males and females, with an out-of-pocket cost estimating from $42,395 to $45,091. The study in Blood Advances takes note that sickle cell disease is expensive to young adults, especially if they don't have insurance. It is important for the transitioning youth to ensure they possess insurance coverage for medical expenses, because sometimes when they transition, they let their insurance lapse because they no longer want to be under their parents' care because they're grown, and therefore we have to make sure that they understand the importance of keeping healthcare coverage, because sickle cell disease or any kind of health problems is very expensive, and going to the ED is very expensive. Lab work is very expensive. Medication is very expensive. It's important for the transition youth to ensure they possess insurance coverage for medical expenses. Researchers also found that survival-adjusted sickle cell disease costs peaked at age 13 to 24 years and decreased at older ages. That's because it takes a period of time for them to understand it's important to keep my health insurance. It's important for me to go to my regular doctor's appointments. It's important for me not to go to the emergency room, for my regular visits when I can have a healthcare provider. Once they learn that, and that's why it's important to have a transitional program, they can stay on track and decrease some of this bill that they will create for themselves. The Center for Medicare and Medicaid Services reports that among 11,790 Medicare fee-for-service beneficiaries identified in 2016, the national sickle cell disease prevalence rate per 100 beneficiaries was 0.20. According to statistics of patients ranging between the ages of 18 to 45, 98.3% have outpatient visits, 75.5% emergency department, and 59.3% inpatient stays. More than 70% of Medicare fee-for-service beneficiaries are dual eligible for Medicare and Medicaid. 4 out of 5 are less than 65 years of age and qualify for the benefits because they are eligible for disability insurance. The September 2020 report for the Centers for Medicare and Medicaid Services reports that there are 41,000, A sickle cell disease diagnosis is not always a rating for the Social Security Administration as a disability. It is important for guardians and the youth to understand that the benefit may end at the age of 18. The youth and guardian should receive documentation from the Social Security Administration to reapply for the benefit by their 18th birthday. So it's important to make sure you're looking out for the mail, because I've had patients that say nothing came in the mail and then their disability benefit ends, and then we have to go back and reapply. If the family believes sickle cell disease is disabling, they may reapply. If reapplying does not occur, benefits that are monetary and insurance, Medicaid, may end. This can cause a disruption to the family's household income, as well as treatment for the transitioning youth, interfering with healthy outcomes. This is an additional stress not only to the patient, but also to the family. Many families depend on the disability check because they have had to stop working to take care of their child or children in some cases. If the benefit ends, there's a possibility of the family becoming impoverished, as well as medical bills being acquired that the family cannot afford. As we see from the statistics, it is very expensive. Medical care is very expensive on its own. Most youth are used to guardians monitoring healthcare needs, setting appointments, handling insurance, receiving disability checks, corresponding with healthcare team members. Transitioning into adulthood changes the way that youth and guardians will have to think and function. There has to be a change. and change will come because you can't stop aging. Goals will have to be set. As pediatric patients, sickle cell disease may limit educational opportunities as well as career goals that patients may have hoped for. What I've seen is some of our patients have been sick so much that they've missed so much school, so many hours of high school or college. Um, they may have set goals that they feel that they couldn't achieve. It's the responsibility of parents, healthcare team members, and whoever their family is to support them in this so they can keep moving forward, because these goals will keep them moving forward in their life and not just staying stagnant where they are. Care teams and family members can assist patients with educational goals such as support of completion of high school, enrollment into training programs, post-high school graduation, and assistance with career exploration. And I have even helped with resume writing. Whatever it is that I can do as a social worker, I am here. I am able to assist in whatever way possible. Other goals patients may have may be learning to drive or use public transportation. If it takes sitting down with patients and showing them how their local transportation company uses their bus system, if it takes putting out different driver school in the areas, these young adults, they are ready to be independent. The parents have to let them transition on. The same way if they were going off to college, if they were going off to the military, these patients are going to transition on, and we are going to be able to assist them in this process. It's a change, it's a shift. The goal should be all person-centered because all patients are different. Everyone has different goals. Whatever this patient's goal may not be the next person's goal. Person-centered with guardians and healthcare team members supporting the specific, measurable, attainable, and realistic time-based goals. Not accomplishing goals can cause psychosocial distress. Everyone knows when you have a goal and you don't accomplish it, you get a little antsy, you get a little anxious. And sometimes that anxiety and that anxiousness can cause a little depression, which then can take you into stress, which then can take you into a crisis. And we want to avoid that at all costs. Psychosocial needs. Complications of sickle cell disease can cause challenges in various facets of life when a patient transitions into adulthood. Some issues are anxiety, body development, and low self-esteem. These issues can cause problems with medical regimens. Transitioning patients may become anxious about how the adult hematology team will accept them and their complaints regarding pain, financial, and treatment responsibilities, like we said before. When they're transitioning and maybe the insurance is not there anymore, so then they can't go to their doctor's appointments, and then they have to go to the ED because they have to be seen because they're not feeling well. Those things all cause anxiety. Or maybe they're afraid of what the new physician will say when they move over to the adult team. So just a warm welcome by the adult team or the adult nurses would be helpful for these patients so they can understand that the pediatric team and the adult team are working together. And being that I work with the pediatric team and the adult team, I can be there and say, hey, I'm here. You need me, just give me a call. When they come to their first appointment, I can be available, just to say, hey, you have someone here that you knew from there. Now you know someone here. And it's just like an equal balance between the two. Sickle cell patients typically feel that they are considered as drug-seeking medication when they go to the ED. That can present as problematic for them because when they go to the adult ED, like Dr. Jackson said earlier, they may never want to go back to the adult side. And I've had patients say they don't feel comfortable, they're angry, they're upset. So we have to ensure that the emergency room understands how these pediatric patients are transitioning. I have met patients in the emergency room. If I see that they're down there, I'll go down there and talk to them. I'll talk to the nurses down there because it just makes the transition a little easier for them. It makes things smoother. It makes them feel more comfortable in knowing that they're transitioning from pediatric to adult care. A young adult typically does not feel comfortable using the adult emergency room or seeing the doctor to make complaints about pain because they don't want to be considered as drug seeking. Some of the patients understand that if the insurance has lapsed, the bill for emergency care or their inpatient visit may not be possible. That is why it's so important to handle all of these things prior to this transition over. Make sure that whoever the guardian previously understands that this is where we're moving towards. Make sure the child understands or the youth understands this is what we're moving towards, so that everything is handled before they even get over to the adult world, so there's no hiccups in between. During the adolescent years, puberty occurs. That's a natural progress of life. In patients with sickle cell disease diagnosis, normal physical development is delayed sometimes. Patients may be smaller in stature, have a delayed or abnormal sexual development, and experience feeling of being different. And I have noticed that with some of my patients. And as they get older, some of them grow. That's a natural progression of life, the same as with other children, same as with regular puberty. As discussed previously, females begin menarche later than other female youths. Males may experience priapism, and both male and females may have significant lower weights and heights in comparison to youth with sickle cell disease. Along with physical development challenges, the youth may have a port, which may cause difficulties in them feeling comfortable wearing certain clothing and participate in certain activities because they are self-conscious of their appearance. This is something that we all have to take into consideration, and we have to think about this when we're working with these transitioning youth. We have to think about it when we're thinking about what they're experiencing and when we're addressing them. And the guardian also has to think about this as well. So again, we're passing the baton. As you see here, you see your dad, he's passing it on. He's moving on, and the daughter is taking it and she's running with it. Young people with sickle cell disease are living longer than previous years and have many adjustments to make. Parents and youth alike will need to pass and receive the baton, allowing the youth to pick up personal responsibilities just as parents do when children leave the home. Planning for the transitioning and starting with discussion with the family around the ages of 13 to 18 ensures that not only is the youth ready, but so are the guardians and the healthcare providers. This concludes my discussion on transitioning. I thank you all for listening. Remember, everyone, that June the 19th is World Sickle Cell Day, and I hope I presented you with something to take back and teach others, and I hope you were able to learn something today. Thank you.
Thank you, Ms. Ife. That was wonderful. We learn a lot every time we have presenters, and we appreciate the opportunity for you to be with us today. At this time, we're going to take a short break. When we come back, we'll be having a discussion with a patient living with sickle disease, Mr. Buford, and we'll have a chance to explore some of your experiences and share that with our audience. Thank you.